Thank you so much for joining us for today's community conversation. We are gearing up for a really important conversation with our guest today. So thrilled here to have Tammy Mahan. She's the CEO of LifePath Systems. Tammy, thank you for coming out and joining us today.
Thank you for having me.
Sure thing. You know, you and I have talked a little bit before this, and there's so much to talk about, especially regarding issues around mental health. But for the people who may not be as familiar with LifePath Systems, will you break down what you all do in our community?
Yes, we're the primary community services provider in Collin County. We provide mental health, substance abuse, intellectual disability, and developmental disability services for all the citizens of Collin County that need those services. We serve all ages from age 0 to 3 with those developmental delays, first with babies, and then from age 3 on up with the more significant mental health that's developing and intellectual disabilities.
And you serve sort of all age groups. Talk to us, sort of drill down to what kind of trends that you're seeing. And people are hearing more about mental health. I think it's more of a conversation, which is a good thing.
Yes.
What are you seeing in terms of trends?
We're seeing a lot of increase in anxiety and depression among our adolescent. I think life is very stressful for that age group, especially as more traumatic things happen across the nation. Our teenagers are really affected by that. That also is showing an increase in substance abuse among both our adolescents as well as adults. Lots of alcohol abuse, opioid abuse is on the rise in our area. And so we've been pulling down additional funds, whether they're federal funds or state funds, to help address some of the opioid crisis here. And Collin County is supposed to be one of the healthiest counties in the state, but we still have significant issues of the substance abuse, also homelessness. We're seeing a lot more homeless, and people that struggle with homeless tend to have more mental health and substance abuse issues. And we're seeing that across the county. And so that takes additional resources. And Collin County is just growing so fast, it's hard to keep up with that level of additional resources. The legislature only meets every 2 years, so we don't get increases in funding every year to meet that population increase. There's over 100 people that move into our county every single day, and there's going to be a percentage of those people that struggle with mental health or intellectual disabilities or substance abuse. And so it's really hard to find the resources as every month goes on to meet a growing and growing population where they need those services.
And how do people come in touch with you all to take advantage of and benefit from those services?
Right, because we don't have a budget really to do a lot of advertising. It's usually word of mouth. Okay. We do a lot of community education, meet with different community education groups and make sure they're aware of our services. We meet with different city officials to make sure they're pushing it out. We do a lot of our own outreach and training. We have a mental health first aid program that reaches out to teachers and churches and businesses, and we can train their individuals on how to address mental health and then refer them to us if somebody has a significant issue. We also have a military veteran peer network program where individuals with military veteran experience go out and try to find other veterans that are struggling and refer them either to ourselves or to other appropriate resources in the community. Different ways like that.
Sure. When you talk about training, you know, so one thing, we have the people who may be going through these different mental health issues, but a lot of this is for the people who are around them, the teachers, the counselors, the pastors, the friends. How do you communicate with those people who may not realize that that training is for them?
Right. It's a tricky conversation.
It is.
I think it all starts with us being a little more open to talking about mental health. I think I've been in the field for over 20 years now, and I've seen a huge improvement in whether media is talking about mental health issues, but there's still that stigma that, especially among parents, and when I go out and do community events and talk to families, parents especially struggle with saying, I think my child is struggling, because there's so much blowback on the parent and judgment that it's the parent did something wrong and caused the mental illness, which we know isn't true. But there's still that sense of stigma, so parents do wait. And actually there's about an 11-year time lapse between when people have their first episode of some sort of mental illness until when they get services. So there's 11 years where people struggle trying to manage on their own, convince themselves that they're not having any problems, it's okay, this is normal, until eventually they seek out services. And we've got to be able to reduce that gap. And the only way we can do it is through just talking. You know, people that watch this need to talk at home, talk amongst your family, talk amongst your friends, your coworkers, to where mental illness isn't such a shaming thing. It's just part of life. We have high blood pressure, high cholesterol, we have depression symptoms, we just have things that we need to address.
And there really is this push to have people talk about our mental health, the things that we can't see, the same way that we talk about those other health issues that may be a little bit more at the forefront. What are some of the things that families or parents learn when they do that youth mental health first aid training that can really help them and their children?
They learn some of the symptoms. Mental health symptoms come out differently in youth. Whereas depression is, we think of an adult kind of isolating and staying in bed all day. Adolescents may have more irritability, but they do withdraw from different things that they previously enjoyed. They may change their look and how they dress. Their social circle may change, but parents aren't always involved in the social circle, so they may not know that. But looking for any of those slight changes in their behavior and how they used to behave versus now, and just talking about it, making it okay to just talk. How was your school day? You look kind of sad today. What's going on? Asking questions and probing for some answers goes a long way, and just showing that you care and that you have time and you can make time for your children is a huge communication in addressing that.
It goes a long way. You mentioned earlier that you all are seeing so much growth in the county and therefore more people who have needs, but the resources aren't always there. How does that affect you all when you're sort of feeling that strain? What does that mean for your ability to provide the services that you like to provide?
Right. Well, there's a high burnout rate amongst mental health counselors, obviously, because we get into the profession because we want to help. We're helpers. We want to see improvements. We want to help everybody. And so we have a lot of staff that put in a lot of extra hours. We get stretched really thin trying to help as many people as possible. As a CEO, a big part of my job is either advocating with legislators and anybody else about how funding is needed, or seeking out those other resources. We apply for a lot of grants. We've received SAMHSA grants and Bureau of Justice grants before, and still do. So anytime we can pull in additional funding on top of what our foundation raises and the different HHSC, Health and Human Services grants that we're able to get, we just keep trying to leverage more and more to keep up with that growth. But it's stressful. Yeah, it's stressful on all of us, and we put a lot of energy into trying to help our staff maintain to where they can stay in the field, because it's very rewarding, but it's a high stress job, kind of like teaching. You know, teaching has gotten a lot of attention, and thankfully they've gotten some increases, but mental health counselors are kind of less acknowledged about how stressful and how low paying it is.
Sure. And we need them so much, especially now and increasingly. So let's talk about how people can support these efforts or jump in and get connected. You all have an event coming up on April 13th. Can you share more about that and the impact you're hoping to make with it?
Yes, it's our annual event where we try to raise funds to fill some of those gaps, bring in services that maybe we haven't been able to bring in before. So it's April 13th. It's called Celebrate to Elevate. We'll be auctioning off different items to raise funds. You can get tickets for the event on our website. It's lifepathfoundation.org. And you can just come, meet other people, hear some stories, hear stories from our staff. We'll have some staff there mingling, being able to talk about some of the things we do and some of the programs we have. It's all about awareness. The more people are aware, the more hopefully they'll donate to help us, but also go home and talk amongst themselves.
Have a conversation. Tammy, thank you so much for being willing to come and share with us today. I know that we could probably talk for hours about all the things that you all have going on, but is there anything else that you'd really like to leave our audience with today for this community conversation?
The other thing I just want people to know is that we do crisis services, and so we have a hotline for our county, and it's 877-422-5939. If anybody is struggling out there, they can call our hotline. We're able to dispatch mobile crisis outreach workers to the home or to somewhere in the community community that they would like to meet, so that we're alleviating some of the stress off of law enforcement and 911, which may not always be the best choice to bring into a mental health crisis. If it is life or death, we definitely want people to call 911, but this is an alternative to help people get directly to the resources they need.
Okay. We'll have that information on our website, as well as information about your event. Tammy, thank you for coming today, and thank you all for joining this community conversation.